Good morning, Peter Goertz. I'm a psychiatrist. Do all psychiatrists have mental problems? When you walk onto an inpatient psychiatric ward, how do you tell which ones are the patients and which ones are the staff members? I used to jokingly say that when I worked on an inpatient psychiatric ward. So what I really mean by that is we want to get away from an us versus them mentality. Psychiatrists definitely can be patients on inpatient psychiatric wards and in psychiatric clinics. We're all in the same boat. We're all human. Now, in my opinion, at least to a large extent, people who go into psychiatry want to help themselves psychologically, want to help their mental health. And that may be at least one aspect or reason as far as why they go into psychiatry, because they have dealt with mental health issues, with psychological despair. And for myself, I experienced as a child some neglect, and I was very angry as a child. I got into fights with other boys my age. I'm talking about age 7, 8. I had self-esteem issues. In hindsight, I wouldn't have called them that back then. And when I was 8 years old they switched me in school to a different class, to a class for slower learning students because of behavioral problems. And I was there in that class for a year, and actually I enjoyed it quite a lot socially. What we've been through can really be a motivator. So if you've been through psychological distress in your life, a lot of it, and you want to pursue psychiatry, the fact that you've been through difficulties mentally can be a strong motivator in getting through medical school and residency and doing all the work that's necessary. So if we have been through our own psychological struggles, experienced the despair, that can create a fertile ground for us to quite powerfully help patients, actually. So there is that, as often there's a silver lining in that despair we've gone through can help us have potentially more empathy and compassion for patients and help them. An analogous story is I once met a surgical resident, and he'd been in a bad car accident, and a plastic surgeon had done a great job in reconstructing his face, and he was very motivated to go into plastic surgery. So that's analogous. What we've been through can really be a strong motivator. When I worked on an inpatient ward, an older psychiatrist more than once said that if someone goes into psychiatry, they've had their own mental problems, or someone close to them, like a family member, has had mental problems. And you do sometimes see interactions that make you think of that. I remember on a ward where I used to work, two of the other psychiatrists working there just shouting at each other, being extremely angry. And then one of the psychiatrists told me maybe within the next week that he'd been to his psychiatrist and been started on a new medication to help him stabilize his mood. Psychiatrists as patients I've seen on inpatient wards. So I myself, as a psychiatrist, have treated other psychiatrists as patients on inpatient psychiatric wards, locked wards. And patients have told me over the years, two patients I'm remembering, that previous psychiatrists whom they saw had committed suicide. Now, what we've been through, like I said, can help us to help others. So if we've been through a lot of psychological distress in our life, that can help us to help others. One aspect of that, though, that's very important in my opinion, is that we don't just leave it at what we've been through, but that we work on ourselves, that we address over the long term as psychiatrists our own mental health, so that we can be in a position to effectively work with patients and help them. So what we've been through inherently can at least potentially give us empathy and compassion for people, patients. But if we work on ourselves continuously over the long term, psychologically, get our own therapy, do what we need to do for our own mental health, that can really help us to work effectively with patients. Thank you.